Good morning. My name is Carmelita, and I'm going to do some teaching and training for your self management over COPD.
Yes, ma'am.
Okay, what do you know about COPD?
What is COPD?
COPD is a chronic obstructive pulmonary disease, which is a group of lung diseases that cause long term breathing problems.
Okay.
Okay, do you have any anxiety over it or any concerns?
Yes. Yes. Weakness. How does it progress?
Okay, well, COPD progresses the more you have your symptoms of the shortness of breath, the coughing, the wheezing. It can lead to more lung damage, which is how it progresses.
And it's not irreversible, correct?
Right.
Okay, that's what the doctor told me.
Okay. Do you know what causes COPD?
No, ma'am.
Okay. Smoking is your number one. There's air pollution, dust, and there's also from certain industrial chemicals that can cause COPD.
Okay.
Are you a smoker?
I used to smoke. I smoked for 10 years, but I quit.
Well, that's good. Okay. Do you know all the symptoms of COPD?
I know a few of them, but not all of them. I've talked to my doctor about some of my management, but that's why I'm here with you today, for you to educate and teach me self-management for my COPD symptoms.
Okay. Well, most of the time, the symptoms include shortness of breath, a persistent
Yes.
cough, and you might or might not have mucus. You can have some wheezing, some chest tightness, maybe some fatigue.
Yes, ma'am, I do at times.
Okay. And do you know why your medications are important?
To help to keep it in check so it doesn't get worse.
Yeah, well, taking and maintaining your medication helps to open your airways, reduce the inflammation, and it helps to clear up the mucus so that your
Okay.
symptoms aren't as bad.
That really helps me understand it better.
Okay, and do you know why it's important to stay with the medication even if you're feeling better?
To keep from getting worse.
Well, it basically helps your symptoms to not come back as hard. It's a symptom control and it helps with your disease management and your overall quality of life.
Okay. Thank you so much.
Okay, and there are some resources out there that can also help you and guide you, give you some more information, maybe support groups.
I would need those. I would. That sounds really good to me.
Okay, there is the American Lung Association. They have the Better Breathers Club. They have the Lung Helpline, and the helpline is staffed nurses and respiratory therapists and tobacco treatment specialists. They answer questions about lung health and COPD.
I never knew all of this was available for me.
They also have Patient and Caregiver Networks, which is an online support group. COPD Resource Library, which just gives you information, worksheets, and tools to help you learn more on management.
That is great.
There is the COPD Foundation. They have COPD 360, which is also like an online support group. And they have extra educational material.
That would be probably a very good benefit for me.
Okay. Do you know what your support systems are?
What could you go over them with me?
Yes. Your family is your number one best source of support. Do you have a good family support?
Yes, ma'am.
Okay. You can also use your friends. There's local support groups, online communities. There's your healthcare professionals. They have smoking cessation programs. You said you already quit, but just in case.
But I still get those urges.
And there's also education programs that are out there to help you.
Yes, ma'am.
Okay. And so what are some of your
some of my symptoms, and right now I'm taking all my medication. I'm managing it. I'm doing everything I should be doing, and right now I am pretty stable with my COPD.
Okay, so to summarize, you were a little concerned. You did have some anxiety.
Yes, ma'am. Yes, ma'am.
But you have a really strong support system. I see that your family is here with you today,
Yes,
so that's
they are.
amazing. So again, you have your online support groups, you have your in-person support groups, and you know why your medication is important too.
Yes, ma'am.
All
Thank
right.
you.
Thank you.